Okay, I'd like to say a few things about bladder weakness. Now, you might assume that we're talking about women. 3.5 million people in the UK have bladder weakness, but a third of them are actually guys. But they never talk about it. They never come and see me or any other doctor in the surgery because they're too ashamed and embarrassed, but they needn't be. Just because it's below the waist doesn't mean to say you have to live with it. If you do, you're going to find yourself socially isolated, you're not going to be going out, you're going to be planning every trip you ever take according to where the next loo is, and there's so much you can do about this problem. Think about Dennis Norden's words. He said that at 20, your heart rules your head, at 40, your head rules your heart, and at 60, your bladder rules both. And he's partially right for most guys because the prostate starts to enlarge and gets in the way, acts like a ball valve at the bottom of the bladder. But there's also infections and irritability of the bladder. All sorts of things can happen. So go and get some help with it. Find out. You don't want to live in ignorance. There's so much that can be done. Think about all the guys who've influenced men's health over the years. Sir Steve Redgrave raising awareness about type 2 diabetes. He was an Olympic champion. Bob Champion, who was the jockey who did so much to raise awareness about pelvic cancer in men and the fact that you can survive from it as long as you get help early enough. There's so much can be done in terms of medication, non-invasive surgery. There's lots of help out there. Go and see someone.